stay a while and listen.
EDA2 may be an aging biomarker and inflammaging target. This protein has a wide variety of negative effects. November 6, 2025. Share. EDA2 is a gene that is necessary for healthy skin development. This protein is a member of the inflammatory TNF pathway and has been linked to alopecia. Further work has linked its overexpression to a wide variety of age-related diseases. Directly targeting this protein may be difficult, but diet and exercise appear to be effective. A review in Aging Cell has cataloged the harmful effects of EDA2, a protein that affects 3 distinct inflammation-related pathways. A necessary protein gone bad. Like nearly every other protein with documented harmful effects, this one is required for certain systems to function properly. The EDA gene is needed for proper skin development, 1, and hair follicle creation, 2, and animals with mutated forms of this gene suffer from ectodermal dysplasia, which causes severe malformations in these areas, 3. However, this gene is a member of the tumor necrosis factor, TNF, superfamily, 4, which provides a hint as to its potential undesirable effects. TNF-alpha is a well-known inflammatory biomarker. As previous work has linked EDA2 to muscle atrophy in cancer, 5, and some evidence has already suggested that it may be a biomarker of aging, 6, these reviewers have gone through the literature to determine what this gene and its protein are doing beyond the skin. As expected, initial work on EDA2 has found that this gene is expressed in the hair and skin, 7. Further work found that it is expressed in the fat, vasculature, and immune system, 8, and a comprehensive tissue expression database found that it is highly expressed in the reproductive and endocrine systems along with many other organs. This gene is located close to androgen-related genes on the X chromosome, so it is unsurprising that it has related effects involving male pattern baldness, 9, and that its tissue expression varies between men and women, 10. That particular study also pinpointed EDA2 as a potential biomarker of aging. Furthermore, and perhaps more crucially, its genetic locus has been found to be associated with lipid and lipoprotein metabolism, 11. There are 3 different pathways by which EDA2 appears to lead to inflammaging. Through TRAF6, the well-known canonical NF-kappa B pathway and the JNK pathway can be activated, but a different ligand, TRAF3, activates the non-canonical NF-kappa B pathway. All 3 of these pathways have been documented to be involved in inflammation, 12 to 14. There have been several studies suggesting a direct relationship between EDA2 and both inflammatory and age-related diseases. Overexpression of EDA2 is associated with an overexpression of lipids related to acne, 15, and it is increased in progeria as well, 10. Another study found that its overexpression is related to many other lipid-related disorders, including characteristics of obesity along with metabolic issues. That study also found a related increase in inflammation, 16. There has also been a documented, significant relationship between EDA2 and frailty, 17. The researchers sum up these findings. Collectively, the evidence from diverse cohorts, animal models, and clinical studies underscores EDA2 gene expression as a robust and versatile biomarker of multiple interconnected pathophysiological processes. Further work appears to agree with this assessment. One study that used UK Biobank data found that the EDA2 protein is associated with premature aging, including both frailty and multiple epigenetic aging clocks, such as phenogage, along with having a negative healthspan association, 18. A different study found it to be associated with a broad range of cancers, 19. Another study found it to be linked to metabolic disorders such as diabetes, 20. And yet another found a link between EDA2 and dementia, 21. A potentially difficult target. The reviewers took some time to discuss the physical intricacies of EDA2 as a protein, including its shape and the protein it binds to. They noted similarities to EDAR and that there are only 2 amino acid residues that distinguish the two, which may make it more difficult to develop a drug that targets EDA2 without affecting EDAR. The protein's folded structure has also not been conclusively determined, although AI-based systems such as AlphaFold have made good guesses, and it is possible to use expensive but slow microscopy techniques to have a definitive answer.